Joining us live now is Catherine Bennett, the Chair of Epidemiology at Deakin University. Catherine, appreciate your time as always. It is an exciting day, of course, where you are. Are you confident that case numbers, though, will soon start to drop in Victoria? How worried are you that those case numbers we're seeing are still so high, just as Melbourne is opening up?
The case numbers we're seeing are probably not that surprising. We're in what looks like a plateau now, but that still means your case numbers move around, and each week you can have a plateau that lasts, for a couple of weeks. You do see these spikes. So, in fact, when I look at the kind of 3-day average, which we plot, and we look at the reproductive number and so on, all the trends behind the numbers suggest we are still in that plateau, and we have to be prepared for these numbers bouncing around. But if this important day, as you say, that we've reached this benchmark, also tells us behind that we have nearly 90% of people with at least one dose. So we've got less people vulnerable now. So while the case numbers are taking a while to turn around and actually start to drop, we are also seeing already a plateauing in hospitalisation. So that's the key metric to watch, and we want that to start to reduce as less cases require that hospitalisation. So that's the important number also for mapping our way ahead and making sure that even if case numbers don't come down as we start to open up, that we are still able to manage down those hospitalisations, not see as many people with serious illness.
New South Wales, obviously, a couple of weeks ahead of Victoria on a number of fronts. How are things progressing in that state? Is it too early to see the full impact of the reopening there? Are things tracking better than expected so far from that epidemiology perspective?
We always see a bit of a lag after you open up, where you're really seeing the effects of the previous weeks when you were still in lockdown. The case numbers are starting to level out. That wouldn't surprise me. It takes about 2 weeks to really see that the first impact if you started to open up. So I think we'll know better over the next few days whether the numbers will rise or whether we'll just see a levelling out and we won't see that drop off continue. Great to start the easing out of lockdown with those lower numbers, of course. But equally, it's still about watching hospitalisations. And there's still been a number of people in hospital in New South Wales, numbers not dissimilar to Victoria, because there were so many that were in there for long stays. It's fantastic to see some of those people leaving hospital now. So those hospitalisation numbers will continue to come down, even again, if there is some bounce back with case numbers. But so far, so good.
Are we moving fast enough, do you think, when it comes to a plan to deliver booster shots? We learnt from the Health Minister yesterday that he's meeting with Pfizer on Monday to really progress things, hopefully, on that front. But are we lagging there? Are you worried we're not on this fast enough?
No, not really. We've got really good data from overseas. So that's what the health department's been watching in real time over this last while. So they're well ahead of this. We're lagging behind other countries for the start of our rollout. So even those people in phase 1A and 1B who will be the focus of booster doses, particularly those with Pfizer, are now coming up to that time point that happened 3 months ago overseas. So I think we're in a good position to get the best of the data. We've already rolled out that third dose for people in the highest risk categories, for the immunocompromised, who wouldn't have had potentially as strong a reaction or as good a reaction to the vaccine initially. They were the most important group, but now looking at those others. So I think we're going to hear pretty quickly what the next plan is, and importantly, we've got the supply now. So this can happen quite quickly as a single dose. And what the Health Minister suggested is, even though we'll have priority groups in terms of those most vulnerable, the older people in aged care residents in particular, and those frontline workers who have high levels of exposure, for the rest of the population, particularly if we're talking about Pfizer, then they would open that up. So it's not necessarily going to be as difficult to roll out as the first part of this vaccine rollout, where it was age structured and we had different vaccines, and we were trying to book people in for 2 doses with the supply challenge as well.
Just finally, there has been a bit of a focus this week on breakthrough infections and breakthrough deaths after we saw the former US politician Colin Powell die earlier this week after he had been double vaxxed. He did have some other underlying conditions as well. What does the data tell us here in Australia about how common these breakthrough infections and deaths are turning out to be?
Well, we do see them, unfortunately, and particularly with people who aren't going to have as good a reaction to the vaccine, who don't mount a strong immune response after those doses. And that's the pattern we're seeing here too. We're hearing from the clinicians that the people who are seriously ill, very few, a very low percent, 10% or less in hospital are fully vaccinated, and even less than that in ICU. And the people that are there are people with complex conditions. So it is important to know that we will see those infections occur in people fully vaccinated, but it's also demonstrating how protective it is for the majority of people. But it's also the reason we want to keep infection rates low in the community, because we still have people, even fully vaccinated, who are vulnerable, and we have to look after those people. And it shouldn't be they have to be, locked away. It should be that we can manage the infection in the community sufficiently so that people can live a full life without needing to worry about being exposed to the virus on a constant basis.
Catherine Bennett, appreciate your analysis as always. Thank you.
Thanks, Ashley.